As already announced in my previous video about the current COVID situation in Thailand, in this video I will provide you with first-hand COVID-19 experience stories of people I know in Thailand in order to better illustrate how the COVID situation here is and how COVID is handled in Thailand. Hi guys, how you doing? If you are new to this channel, I am George Thai and you're on My Thai 24. Some might ask, why again a video about COVID? Actually, I also want to make other videos and I have many awesome videos about Thailand, Thai people and their culture planned. But actually, these COVID-19 experience stories were initially planned to be a part of my last video, the video about the current COVID-19 situation in Thailand. But as that one would have gotten too long, I decided to make another video for the COVID-19 experiences. Moreover, the topics which are most important for most people at the moment is the COVID-19 situation in Thailand and how to be able to enter Thailand for a holiday and whether it is worth coming now. Just ignoring the elephant in the room would be also not a good idea in my opinion. I will leave a link to my last video about the COVID-19 situation in the description. In this video, I will begin with first-hand COVID-19 experience of a family which my family knows very well, who are also living in the same district of Bangkok as we do. After that, I will sum up some more additional informative COVID-19 stories of people I know here. Okay, let's start with the COVID-19 story of the family we know very well. It is a family that consists of parents in their mid-40s and two twin daughters aged 20 years. So altogether there are 4 people in this family. I will not disclose names due to privacy. One of the twin sisters worked part-time somewhere in a shopping center in Bangkok, having quite a lot of customer contact there, but of course always wearing a mask. I will call her twin daughter A from now. She was fully vaccinated with 2 doses of Sinovac quite some time before she got infected with COVID-19. One day in early July she got sick. Her symptoms at the beginning included fever, fatigue, sore throat and headache, and about 3 days later also cough, and then soon after that the for COVID-19 quite common and typical loss of taste and smell. At the beginning the mother and her twin sister apparently did not really think of COVID-19 that much, quite likely because she was fully vaccinated and thus were not that careful, but the father was more careful as he is a diabetic and thus kept distance. As the symptoms continued, she also developed the already mentioned loss of smell and taste. They finally decided to test her. And they used a mobile PCR testing service which they had at the company of the father that time. She tested positive. After the test, she contacted the COVID-19 hotline 1330 for people who do not have any social security, which she apparently did not have at her part-time job, and she was put on a waiting list for quarantine and treatment. About 5 days after twin daughter A, the mother, who already had 1 dose of the AstraZeneca vaccine, developed the same symptoms as her daughter, plus a significantly more severe cough with a lot of mucus. A few days later, the unvaccinated twin sister got sick too, having also the same symptoms. I will call her twin daughter B from now. The mother got most severe sick and also developed breathing difficulties and felt like she had pressure on her chest. She wanted to test for COVID-19, but there was not the opportunity with the mobile testing service at her husband's company anymore. Thus, it got more difficult to get a COVID-19 test. As she has a job with Social Security, she had to contact the hospital which she has registered for with her Social Security. For your information, in Thailand, people with Social Security, the so-called Prakan Sankkom, have to choose one hospital and register for this, and only there they can get medical treatment free of charge in the frame of the Social Security system of Thailand. If you have Social Security, you are supposed to get tested at the hospital you are registered for the Social Security. The test is free of charge. At the hospital which she had registered for her Social Security, it was very busy and thus difficult to get a COVID-19 test. They had to follow a certain procedure. In the morning they were handing out the queue tickets for the COVID-19 test in the early afternoon. Her husband brought her there on the back of his pickup truck, as he was quite afraid to get infected because of his diabetes, which is a risk factor to develop severe COVID-19. But luckily the weather is warm in Bangkok and it was not raining that day, so it was no problem. They arrived there at around 5 in the morning, and according to their estimations, more than 200 people were waiting in front of the hospital. As they handed out the queue tickets, people were almost fighting for them. People were really desperate. They were jostling and pushing each other like it was a life or death situation. People were falling down to the floor, and some really sick people even fainted, and this was about the second week of July, when case numbers were significantly lower than now. So you can assume that this problem is much bigger now. This also scared the mother a lot. The problem is that people know that there's a significant shortage of hospital beds, and even more significant ICU bed shortage. So they know if they are unlucky and get really severe symptoms and urgently need help, help could come too late. Therefore, totally understandable, many people better look for a hospital bed before they get really critical ill. This consequently leads to an even longer waiting list, as quite a lot of people apply for a hospital bed even though they finally do not really need one and also could have been treated at home. After the mother finally could get a queue ticket, they returned home, and in the early afternoon of that day they went there again to get tested. The mother got a negative result for a COVID-19 test, which was really confusing, as twin daughter A was tested positive and they had almost the same symptoms. Then they waited for the test of twin daughter B. She got tested at another hospital where she had her social security. At that hospital, apparently, it was better organized and less chaotic. She tested positive too. So the twin daughters were both tested positive, but the mother negative. Quite surely, the test of the mother must have been erroneous. Meanwhile, both of the twin daughters were on waiting lists for hospital beds, but the mother not, as she was tested negative, even though she had pretty severe symptoms, more severe than her daughters, and actually it was quite obvious that she also must have COVID like her daughters. So she decided to test again, but this was not immediately possible, and thus even more time was lost, which was very worrisome as she was really sick. The second test was finally positive, and then she was also put on a waiting list for a hospital. As the symptoms of the mother were quite severe and scary, they even tried to find a hospital bed for her via posting on social media, like so many do, in the hope to get a hospital bed faster, as it was completely uncertain how long they have to wait to be picked up and sent to a hospital. They were just worried that it might be too late. By the way, after the mother tested positive, they did a chest X-ray, and luckily the lungs were not infected yet. But due to her acquired severe symptoms, the doctor prescribed her antiviral and other medication, which she could take at home and wait until she was picked up and sent to the hospital. By the way, the father was sleeping in his van all the time as his twin daughters and wife were quarantining at home in their townhouse, waiting for a hospital bed. He also could not work as he had contact to all three of them. So he did not only stay in his van for the protection of himself, but also as he had to isolate to protect others. Luckily, finally, he was not infected with COVID-19. But by the way, the neighbors of this family were also really scared of them and built up some protective sealed wall in addition to the wall which was in place there anyway. Nobody of the neighbors helped them. So it was up to the father to provide all of them with food, even though he was supposed to isolate. And we also helped regularly as much as we could by either cooking food for them or buying some healthy food at our regular restaurant for them, and also other things which they needed. The first to get a hospital bed was finally the twin daughter B, who developed symptoms after her mother and twin sister. Actually, it was not a hospital bed, but a so-called hospital bed. Hospital is a word creation out of the words hospital and hotel. This is a bed in a hotel which is particularly prepared for quarantining COVID-19 positive people under medical supervision by doctors via telephone and a nurse visiting and checking on them regularly. She had to share the room only with one other COVID-19 positive lady. Twin daughter A got a hospital bed quite some time later, more than 2 weeks after getting sick, but her mother still did not have a bed. However, luckily they could make a deal with the people in charge for the allocation of hospital beds, and they allowed that the mother accompanies twin daughter A to a field hospital where both of them could be quarantined and further treated. The mother also told us a bit about the conditions in the field hospital. Obviously, there were lots of people, lights were always turned on, also in the nighttime, air conditioning was fully on and made it freezingly cold there, which certainly is counterproductive for people having a respiratory disease like this. Announcements of medical details of patients were made over a speaker system, and thus everybody could listen and hear them. Announcements like, for example, Mr. X, your lungs are severely infected with COVID-19. Please pick up your medicine at counter A. The toilets there were really dirty and the food was not good at all. Moreover, some people were really sick and lying close by. She told us of one old lady peeing in her bed. There must have also been quite some smell in this field hospital. Overall, many people must think now that this is not an ideal place to recover from a disease like this, particularly not if you have severe symptoms. Luckily, after being there for only 2 days, she and twin daughter A could transfer to a hospital like twin daughter B. After having completed 2 weeks quarantine, they could get back home, and the mother and her 2 daughters have to isolate for another 2 weeks at home to be 100% sure that they are not contagious anymore. So after about 2 to 3 weeks of having symptoms and being sick, all of them are okay again, but the mother still has some mild symptoms like cough and mucus, which still have not completely disappeared yet. Here it is remarkable that the unvaccinated twin daughter B was the fastest to recover and not having symptoms anymore, faster than her with Sinovac's fully vaccinated twin sister. Slowest to recover was the mother who already had 1 dose of AstraZeneca. One really unbelievable thing to mention is that twin daughter A was fired by her employer right after he knew that she got COVID. And he even told her that he wants compensation from her if anybody else in his business gets infected. This made her and her family even more worried while fighting with COVID. Just incredible mean and unfair, particularly also because quite likely she caught COVID-19 during work or on the way to work. If this video is interesting for you, please hit the like button. Thank you. Now some more COVID-19 stories of people we know, but I try to make them brief. Let's go on with a family which we know also really well. They live in Samut Prakan, which is just next to Bangkok. A family with 2 young kids aged 1 and 4 years. The father of this family got infected at work and got also the same symptoms as the people of the other family we know. He was sure that he caught it from the food of a Luk Chin seller, a meatball seller, where he regularly bought snacks at work, as it was revealed that she had COVID. And beside that, there was nobody else at work who had COVID. He had to quarantine at home first. He stayed in a tent in their garden as his wife was afraid that she and the 2 young kids get infected. The very nice thing about their story is, and also the reason why I mentioned their story, is that the neighbors were overwhelmingly helpful. They bought food, diapers, grocery, and everything else which a family with 2 young kids needs. They bought it without being asked for help. They were just buying it and bringing it over. This was very heartwarming to hear this. It is also a story of hope. People help each other in these times of distress and crisis. Neighbors who they hardly had contact with before. Finally, the father of this family recovered, and luckily nobody else of them got infected. Another story. A friend of my partner, a Thai lady in her mid-30s, got infected while working as an insurance agent in a shopping center in Bangkok. She was also quite seriously sick. The infection had gone down to her lungs. She also infected her boyfriend, who got less serious sick. Both of them were quarantined and treated in a so-called hospital and finally are fine again. Another lady in her 30s, who is a relative of someone I know in Bangkok metropolitan area, got also COVID, and the infection went down to her lungs too. Thus, she got also antiviral medication. As side effects from the medication, she developed apparently high blood sugar levels from this treatment. Another former colleague of my partner, a Thai lady, and her German husband and their 11-month-old kid got COVID too. The child had symptoms first, namely high fever, and only a bit later both the Thai lady and her husband, who already had the first BioNTech Pfizer vaccine dose, developed COVID symptoms too. For both of them, the infection had already traveled down to the lungs and they needed medical help. It was difficult to get a hospital bed, but finally they could get one in the private hospital where the little daughter was born less than 1 year earlier, because the doctor who took care of the child delivery last year helped them. According to them, they were infected with the Delta variant. Luckily, all of them recovered well and could discharge from the hospital. On discharge day, they were stunned by the bill that they had to pay. It was really expensive. The total for all three of them was 600,000 baht, about $20,000 for 2 weeks in this hospital, and even having to share the room with other people. They expected that at least partly the government pays for it, as there is an official policy that the government pays for all COVID-19 treatments. But quite surely they do not pay the normal rates of the private hospitals but expect lower rates, which is the reason why some private hospitals do not accept this deal and thus charge patients their normal rates. Has only a so-called COVID-19 insurance, but no health insurance. Last year, as COVID-19 cases were still really low, lots of insurance companies sold COVID-19 insurances cheaply for premiums as low as 500 Thai baht. They tried to make a quick buck with the COVID fear of the people, which seemed to be not that risky last year, but this was very short-sighted and a huge miscalculation, because this year the numbers went up to high heights not expected by them. Thus, last month, the insurance company Sun Mun Kong cancelled all COVID-19 insurances, citing that the risk is too high due to the current escalation of the COVID-19 crisis. This was a big shock and undermined quite a lot of confidence in all of this kind of COVID-19 insurances, as hospitals are not sure if they finally get the bills paid. This apparently also seems to be the case with this friend of my partner, and thus they have to pay at least the bill of her and her daughter. The German apparently has a health insurance for himself. Here I just can advise anybody, you should have a proper health insurance for you and your whole family when you stay in Thailand, otherwise you can get into deep financial troubles. Another quite worrisome story is a story a German told me who is living in my neighborhood. He said that the gardener of his Thai girlfriend was infected with COVID and did first not have any symptoms at all, but had to quarantine in a field hospital. Only a few days after admission, he developed severe lung symptoms like breathing difficulties and died. The German is really surprised how this could happen. Apparently the gardener was still rather young, did not have any pre-existing health conditions, was not overweight and actually quite sportive. Another story, a father of a daughter of a Thai lady I know in Bangkok. He is in his early 50s and got infected with COVID a couple of months ago, as the case numbers in Thailand were much lower than now. Even though he is a businessman and has no shortage of money, he had hard times to find a hospital bed. As he finally got one, his infection was already so serious that right after admission he was directly sent to the ICU. He survived, but it took quite some time to recover. It was kind of a surprise that he got so seriously ill from COVID-19, as he was sportive and had quit smoke a long time ago. However, the doctors said that even former smokers have a significant higher risk of developing severe COVID and that this might be the reason for it. Recently, the mother of the twin daughters told us that in her neighborhood, 2 people died from COVID. One of them in his late 30s, another one in his early 40s. The latter was apparently first rejected by a hospital and thus had to wait and try to recover at home. Finally, his symptoms deteriorated and he urgently needed help and went to a hospital again, but it was already too late. They could not help him anymore and he died. The last and the latest story is of a good friend of my partner too. We just heard of it a couple of days ago, and it is an ongoing situation. All 4 of the family got infected with COVID-19. They have driven with their own car from Bangkok to Buriram and had to quarantine there in tents on the property of a temple. First, the little 2-year-old son started to have high fever. They asked for help from a doctor and were refused. As the fever did not get better, they went to the ER in a hospital in Buriram, and they tested the boy for COVID and he tested positive. The little boy, together with his mother, who also had developed symptoms like fever, headache and sore throat, had the chance to be admitted, but the father and the other son not, even though they already had symptoms too. In this hospital, they made an X-ray of the chest of the 2-year-old and they discovered that the lungs have already been infected after only having symptoms for 3 days. After getting antiviral medication, the little boy got better, but the father and the old brother of the 2 years old are still in quarantine at the temple quite likely have COVID-19 too, but the hospital is still refusing them to get tested and get treatment. The day before yesterday, the conditions of the friend of my partner deteriorated and she developed significant breathing problems and then was separated from her little son, which is really tragic and worrisome. Feel very sorry for this little boy and her too. Actually, I could tell more COVID-19 stories of people we know, but let's finish here as it would get just too long. This video is also for the people who always doubt that COVID-19 exists and think that it's all a hoax. At the beginning I was also really skeptical of all that, but as more and more people I know or people friends of mine know got this disease, both in Germany, where I come from, and in Thailand, it got obvious to me that this disease exists and that it is also more severe than the flu, particularly also because the lungs seem more often to be affected and thus hospital treatment is more often necessary. If any of you has any COVID-19 stories of people you know in Thailand, feel free to share them with us in the comment section. Thank you. If you have any questions or would like to add anything, please do this in the comments too. Thank you. If this video was valuable for you, please hit the like button. Thank you. I will have many more interesting videos about Thailand coming up soon, so please subscribe my channel and make sure you don't miss them. Thank you very much for watching and I catch you on the next one. Bye!